Welcome back. Spectrum Health, leading the way once again. They're offering a new investigational treatment option for patients with chronic obstructive pulmonary disease, or COPD. Here to discuss this new procedure is Dr. Gustavo Cumbo-Nacheli, Spectrum Health's Director of Bronchoscopy Services. That's a tough one. Hello, good morning, doctor. How are you?
Good morning. It's great to see you again.
Yes, it is. Great to see you once more. For those who may not be familiar with chronic obstructive pulmonary disease, what is COPD? What are the symptoms?
Absolutely. When we talk about COPD, we're talking about chronic obstructive pulmonary disease. Chronic means that it's not going to go away. Obstructive means that something in the air pipes are getting blocked. Pulmonary means that it's in the lungs, the organs that allow us to breathe. And disease is sickness. And this is way more frequent than what people think, with roughly 25 million Americans being affected by this. Most of them don't know. And unfortunately, it's a very, very, very serious condition that is actually the third leading cause of death in the United States.
Doctor, you mentioned that some people may not even know that they're walking around with this disease. What would someone notice about themselves? Just difficulty breathing?
Absolutely. COPD is an umbrella term that essentially means two things. It could be emphysema, where somebody's lungs have been destroyed for whatever reason, most likely smoking, air pollution, or a family history. And bronchitis, which is those patients that have some shortness of breath with a little bit of junk, and the air pipes clog up and the chest feels congested. In the morning, they cough a lot of junk. So any of those two, either emphysema or bronchitis, could be part of COPD that needs a very comprehensive treatment plan in order to prevent what right now is unfortunately, a very poor quality of life for most of our patients.
Absolutely. I can only imagine that morning that you described. This new treatment, this investigative treatment, what is it, and can describe how it works?
Absolutely. In a nutshell, what we set out at Spectrum Health is to provide cutting-edge medicine and techniques in order to prevent diseases from getting worse. And we're hoping that we can prevent all of these lung attacks. Oftentimes, patients that have COPD, they can have a calm, like smooth sailing, a little shortness of breath. I can get by the day, take the garbage out, walk the dog. But there's sometimes in life, more about 55, 60 years old, that our lung function, as any machinery, will start declining a little bit. And every now and then, we're going to have an accident. That's what we call a lung attack. And lung attacks are very dangerous because those are the situations that patients feel that they need to call their doctors and they need to get steroids or maybe antibiotics. And in more severe cases, they have to go to the hospital to be admitted, to be cared for. And in some really severe cases, they end up in a breathing machine for a few days, even longer. What we set out to do at Spectrum Health is try to prevent those lung attacks that will put our patients in a situation that is fairly distressing for them and disruptive for their lives and their loved ones as well.
Now, this clinical trial that's happening in West Michigan, can you speak to that? How can patients contact you if they think they can be part of this trial, and what is involved in the trial?
Absolutely. When we talk about trials in the U.S., for the most part, we have been doing things that sometimes they have been done in Europe. So we have really good information that in an outpatient procedure, no cuts, it's a procedure that we go through the mouth with a special scope. We can reach the main air pipes that get tight and don't let our patients breathe, and they're more prone to have a better symptom-free by getting a very specialized procedure in which we use a form of electricity to cut very small nerve fibers that are the ones responsible for shrinkage of the pipes. So, outpatient procedure, no cut, endoscopy, we find those fibers that have been causing trouble, and we sever them with electricity with pinpoint precision. Therefore, the patient should go home on the same day, and we hope that in the future, these lung attacks are way less frequent and hopefully none. That's what we're investigating. We have a very good safety profile. We are roughly 20 to 22 centers in the country, and we're proud to say that Spectrum Health is supporting this initiative. We want a healthier community that...
Oh, looks like we may have lost our signal right there at the end. There you are, Dr. Cumbo-Nacheli. Thank you so much for the time. I can't believe what I'm hearing. Electricity to cut with pinpoint precision, and it's in and out, outpatient. It's through your mouth and endoscopy, as he said. New treatment for COPD at Spectrum Health Pulmonary Services. You can call 616-267 8244. Or if you want to learn more, spectrumhealth.org/patient care/pulmonology.